There's conflicting reports this morning over the health of North Korea's leader, Kim Jong-un.
Yeah, he's not been seen in public for 10 days, with the US closely monitoring reports he was in grave danger after undergoing heart surgery. International security expert John joins us now from Canberra. And John, North Korea is such a secretive country. How accurate or credible do you think these reports are?
Yeah, no, it's very hard to tell. The original source is from a network associated with North Korean defectors. They seem to be pretty well connected. The South Korean government has denied it, but President Moon Jae-in has been quite keen to play a positive role and be constructive in its engagement with North Korea. And of course, the US sources are equivocating as to what's going on, in large part because really it's hard to say, because North Korea is so opaque, it's really hard to tell.
Italy is in lockdown. 60 million people are now in lockdown as the entire country is declared a red zone. The unprecedented measures will see public gatherings banned, sporting events cancelled, and people urged to stay in their homes. It comes as the death toll rises to 463, making it the worst hit country after China.
We need to talk about Italy to start. Italy, it's just closed its borders, locking down 60 million people. This is huge and disturbing news.
Well, this is obviously a very significant development, and it just reflects the uncertainty and the seriousness of the spread of the coronavirus. And Australia moved ahead of many other countries in putting in place travel restrictions. That helped ensure that the spread of the virus here in Australia was not as great as what we've seen in other countries like Italy, South Korea. But obviously we'll continue to take the best possible advice from our Chief Medical Officer and continue to reassess our travel restrictions.
So it turns out coronavirus spread throughout American cities undetected much, much earlier than anyone realized at the time. That's according to a new report from the New York Times. On March 1st, 5 major U.S. cities, New York, San Francisco, Boston, Chicago, and Seattle, had a total of 23 confirmed cases of coronavirus. But a model of infection rates by researchers at Northeastern University estimates that there could have actually been 28,000 undetected infections in those cities by that time. This visualization from the Times shows a remarkable disparity between those two sets of numbers. The model suggests that by the time New York had its first confirmed case of coronavirus, there were already 10,000 people infected. This new information as New York begins work on a plan for widespread testing and contact tracing.
Rome's deserted landmarks tell only part of the story of this pandemic. Now, with the world's highest official death toll from COVID-19, Italy's called in the army to help truck the bodies away from overflowing mortuaries. In this emergency ward, a video call with relatives helps a man recover from the disease. But doctors are distressed that many of their patients are denied a final farewell with loved ones.
The greatest problem that's emerging now is that patients can't be visited by their relatives, and often they die alone.
Health workers too are falling ill.
At the moment there are 8 doctors here, but only 2 are from this hospital. Unfortunately, the other 6 tested positive for coronavirus, and they've been replaced with an emergency backup team.